Welcome to another edition of Valley Views. I'm Bob Richards, and this week on the program, we are going to be talking about your health, specifically whether or not you need a joint replacement. There is a program up here in the Valley that is worth your attention if that's something you're thinking about. And today I'm in the Stewart Avenue Clinic here in Alamosa, talking with Dr. DeFee. How are you, sir?
I'm doing well. How are you?
I'm doing great. Thank you for taking the time to talk to us today about what you guys have going on. Let's start with the actual event itself, and then we'll dig into the nuts and bolts of what it does and how it works. There's going to be a free seminar on August 8th at 6 o'clock, and this is going to be at the Mountain View Restaurant, 2099 Sherman Avenue in Monte Vista. And this is a free dinner for those of you who may have some questions about whether or not joint replacement is for you. And Doc, you're going to be one of the docs there that night?
Yeah, I'll be there, and my partner Carissa Trippi will be there. And then we hope to have some more people from our team, maybe some physical therapy folks, and maybe even our surgery coordinator to help to answer questions and maybe fill in some of the blanks that they have a little more expertise on their end than even we do.
Understood. All right, let's talk a little bit about joint replacement, how prevalent it is. Before we get into this, I want to tell you a little story about my 85-year-old mom, and then you can tell me if this is something that you run into on a regular
Sounds
basis
good.
with what you do. So Mom was convinced that she was down to bone on bone in her knee, a lot of knee pain. And she went to Dr. Google, and Dr. Google basically told her, yeah, you're going to need a knee replacement. She went to the surgeon, and it turned out that she didn't need a knee replacement at all, which was great news for her. She was all concerned about going under the anesthetic and all that sort of stuff that an older person, any person would really have to think about and consider. And it turned out it was a back issue for her that physical therapy is going to be able to fix. So I guess that opens up all kinds of questions, and let's get right into it. If somebody comes to this dinner, they're already thinking they may have an issue, they may need the surgery. What would you tell folks about what this seminar will do and how you can help them in that decision-making process?
So that's a great way to start this. As awesome as Google is, sometimes real humans are able to answer questions a little better.
Yeah.
So I think the big point about this seminar or get-together or whatever we want to call it is having people be able to interact with both me and Dr. Trippi directly so that maybe we can answer some of their questions. Sometimes just being able to hear someone's history or kind of what kind of pain they're having, how it's affecting them, can help us guide them whether it's worth coming in to see us, whether it's worth getting some x-rays or what the next step is. So I think that's kind of the primary push on this is just to have face-to-face contact with people who are wondering, does it even make any sense for me to be thinking about this, or should I be going down another road?
Well, is there what you would consider to be a target demo for this? Who would you tell me is the right person to come to this event?
Yes, almost regardless of age, but, folks that are in their 60s, 70s, 80s, those are the most likely candidates for joint replacement surgery. So it may be folks that have had, knee trouble, hip trouble, shoulder trouble, that's kind of gone on for years and is affecting their quality of life. So those are the people that we would really want to look for, not just to try to go down and sign up a bunch of people to get joint replacement surgery, but to be able to interact and say, maybe you have a problem that you don't need a joint replacement, but we have other options for you. And I think it's a good chance for them to interact with our physical therapy folks as well.
Yeah.
Because as prevalent as joint replacements are, we still treat a lot of people with other options than having a joint replacement. So that kind of interaction, I think, would be really good at this meeting.
All right, let's talk about the team that you mentioned. Let's tell folks what you guys do up here and try to dispel the notion that when you need a surgery like this, you need to leave the valley to get it done. That's not true, is it?
That is not true. And it's hard to convince folks sometime that they don't have to go to the big city. I mean, there are surgeries that we don't do here that are either more specialized or just really rare so that we don't get the repetitive nature that we need to be really good at doing that surgery. But certainly knee replacement surgery, hip replacement surgery, shoulder replacement surgery, those are things we do here weekly. Between me and Dr. Trippi, we're probably talking about thousands and thousands of cases that we've done between us in our career. So I am very confident in our hospital and our ability to provide that type of service for the community. And realistically, even if you look at us compared to bigger institutions in the big city, we have a very low infection rate. We have a very low complication rate. So I would hate for people to drive out of the valley just because they think we can't provide that service here.
Agreed. Okay, let's talk about the process a little bit. How prevalent is it that you find that folks need these replacement surgeries here in the valley?
So I don't want to bore anybody quoting statistics, but especially knee replacement is projected to just increase astronomically over the next decade. And there's probably a lot of reasons for that. One, we're living longer than we used to. And two, more folks that were really active in sports and stuff and had injuries are kind of getting to the age where they even might need joint replacements as well.
Right.
So it's hard to put a number in our valley. However, we know that there'll be more and more people year over year that will be candidates for joint replacement surgery.
Sure.
You know, from the weekend warriors who've been really active and kind of worn their knee or hip out because of their activities, to just folks that have lived a long life and have gradually worn their joints out over time. We know there are a lot of those kind of folks here in the valley.
If you're just tuning in, we're at the Alamosa Stewart Avenue Clinic for SLV Health, and we are talking with Dr. DeFee, who is going to be one of a couple of doctors that are going to be hosting a joint replacement seminar at the Mountain View Restaurant, 2099 Sherman Avenue in Monte Vista. This will be taking place on August 8th at 6 o'clock. If you think you're a candidate for a replacement, you need to come to this dinner and ask the questions of the doctors directly. They will supply the dinner for you, and you can learn about knee, shoulder, or other procedures right from Dr. DeFee or Dr. Trippi and the team there at SLV Health. Let's talk about this seminar a little bit more. Obviously, if people come there, they're going to have all kinds of questions about their personal issues, and this is not a situation where you're going to start examining people and tell them what they need, right? So what's the best outcome folks can expect from coming to this dinner?
So hopefully we'll get some general questions answered, just kind of nuts and bolts of kind of what we do and what we offer. And then certainly if folks are interested in having an exam or coming to the office, we're going to make ways available for people to be able to go ahead and make an appointment to see one of us. We don't ever want to get too personal in a public kind of forum, but you would be surprised how many people have the same questions. So if people come to the meeting, I would encourage them to ask their question no matter how minor they think it is, because the person sitting right next to them could have the exact same question and just not be willing to ask it.
Right.
So questions about the recovery time or questions about how long folks stay in the hospital after joint replacement, those are things that we can answer very easily, and a lot of people have the same kind of questions.
Yeah. And I hate to generalize with this particular question, but I know it's probably a big question on the minds of most in the audience. What would you tell me, generally speaking, about how insurance treats something like this?
So certainly if folks have Medicare or Medicaid, this is a regularly paid for service. And then even in commercial insurance, we rarely, if ever, have insurance denying or not letting us schedule the surgery.
Yeah.
Sometimes, depending on which commercial insurance company's involved or whatever, we may have to jump through a few more hoops before we actually get to schedule the surgery, but usually it's not an issue.
Got it. All right. How many of these things do you do over the course of a year?
Yeah. You know, I wish I had the numbers in front of us, but routinely, I like to do, if we have the volume and we have the people that want the surgery, I would routinely like to do 2 or 3 joints a week. And Dr. Trippi, for her, she's probably wants to be even busier than I do, so she would like to do probably 3 or 4 joints a week. And that's divided between shoulder, hip, and knee replacements. Now, obviously, our goal is if the volume is there and people want the procedures is to do what needs to be done.
Sure.
So we can always ramp up if we need to. But kind of in that range, probably between us with the size of our hospital, if we're doing anywhere from 6 to 10 joint replacements in a week, that's a reasonable volume for our hospital, and we're able to easily take care of those folks.
And what kind of stay is it?
So the trend for almost all joint replacement surgeries is shorter hospitalizations. Almost all the studies show that the faster we get people out of the hospital and the faster we get them up walking, doing things, the better they do.
Yeah.
So routinely on shoulder replacement surgery, that can be done as an outpatient procedure or just an overnight stay. And then for our hip and knee replacement surgeries, our goal is to let people go home on postoperative day number 1. Doesn't happen for everyone, depending on kind of their age or their health beforehand, but usually leaving the first or the second day after surgery is the plan. And then some folks we can arrange, if they're not able or they have a social situation where going back home's not the best option. Usually if they stay in the hospital a few days, we have options to have them transferred to like a skilled nursing or a rehab type facility to extend their stay if they need
Got
to.
it. All right. Well, I'm excited to get this news out to the Valley because I think probably the overwhelming majority of people would think that they would have to leave the Valley for something like this, and it's just not true, and it's exciting that we can provide this kind of a service here. Our radio station serves the 6-county area. Where did some of your clientele come from? Is it pretty much just the Valley or from around?
So mostly from the Valley, but you'd be surprised. I mean, I have several patients from Taos that have come up here to have their joints done.
Yeah.
I know Dr. Trippy's had the same experience. And then about far south as you can go. We have had folks come up from Trinidad. A couple of my favorite patients have come up from Trinidad. So kind of all over.
Yeah.
But, this is mainly targeted for our home audience. But certainly, we want to provide care to whoever needs it.
Yeah.
So, if we have people coming from out of the Valley, that's great.
I really only have one more question, and then I'll let you finish with whatever statement you want to make, or if I may have missed a question here or there. But one of the things that gets a lot of attention is the painkillers that you receive when you come in to have any kind of surgery. What would you tell folks who may be a little hesitant from that standpoint about what they'd be looking at with this surgery?
So, obviously there's a big push now to use as little narcotic pain medication as possible, and we try to follow that. It doesn't mean we're not going to give you any.
Right.
I mean, my goal, and Dr. Trippy, I think, would say the same thing. These are real surgeries. These are big surgeries. They're real surgeries. There's going to be pain involved. So we're probably not going to get you to zero pain, immediately post-operatively. So that's why the pain medicine is there, to try to get you to kind of a functional level so that you're able to do your therapy, able to get going as fast as we can. And then routinely, we want to try to wean you off those as quickly as possible. And then even if we're still using anti-inflammatory medicines or Tylenol or something just to try to take the edge off, we'll still do that.
Yeah.
Realistically, folks worrying about getting addicted to pain medication after a joint replacement surgery, statistically, the numbers would say that that's a low chance of that happening, especially if we manage them appropriately together.
Yeah. Well, what did I miss? What else do folks need to know?
I don't know anything in particular. I have been told that the dinner's going to be a barbecue. So brisket. So if we have folks out there that really want to get their hands on some barbecue, that's a good excuse to come to the meeting. And then the other thing I would say, even though it's kind of geared at joint replacement procedures, we're going to be mainly talking about shoulders, hips, and knees. So folks that may have shoulder, hip, or knee trouble that want to come, we're not going to run them off.
All
So,
right.
I mean, I feel like it's a good chance for us to be in the community, meet some people, and answer some questions.
Excellent. Well, sir, I appreciate your time. Thank you very much. This sounds like a great deal for the community. Let me run through the particulars one more time for folks who maybe didn't hear them. This is going to be a free joint replacement seminar. Once again, it's going to be in Monte Vista at the Mountain View Restaurant, 2099 Sherman Avenue. And it's going to be August 8th, so coming up quick at 6 o'clock. And you can ask all the questions you want about knee, shoulder, or other procedures from Dr. DeFee, who we've just been talking to. Will Dr. Trippy be there too?
She certainly will.
Excellent. And others on your care team as well?
Yeah, we plan for a physical therapist to be there, and then hopefully our surgery coordinator as well.
Damn, that's a lot of brisket. Is Donna paying for that?
Well, I just hope it's not me.
Fair enough. Thank you, sir, for your time. I appreciate it. And thanks for all you do for the community here in the Valley.
Thanks for having me, Bob.
Well, if this joint replacement seminar sounds like it's something you're interested in, you need to RSVP to Donna Weehee And her phone number is 719-587-1209. Or you can email her, donna.wehe, W-E-H-E, at slvrmc.org. The phone number one more time, 719-587-1209. And you should RSVP and come to the seminar. Once again, it is August 8th at 6 o'clock, and it's going to be held at the Mountain View Restaurant. Thanks for listening this morning.